This video contains 8 essential reminders for the pharmaceutical product specialist, also known as the key accounts manager, the medical representative, and the territory manager, among others. So, apart from scheduling regular visits, presenting company products, and submitting sales reports, what is our essential function? Number one, the primary goal is to establish a personal relationship with our HCPs. This takes time and effort, and there are no shortcuts really, but there is nothing more effective than an established relationship in medical sales. And establishing and maintaining your own network is essential so you can access the right people. Later, in years to come, when you have been promoted to a regional sales manager, territory manager, or a marketing manager, you will still have these vital connections, these relationships that you can turn to. You may not know everything, but you know who to phone. You will have HCPs that are fond of you, that have a relationship with you, that trust you, who you can say, does this marketing detail aid work? And who can quite honestly say, actually, no, or this part is gold, that part I can't relate to. And we need that authentic, frank feedback from our HCPs. So establishing our own and maintaining our own network is essential. Now, as an aside, what is required for this? Empathy, listening skills, and a natural inborn desire to connect and to help people solve their problems. Yeah. So clearly one has to be intelligent, but advanced degrees are not the essential thing here. Number two, it is essential to have a real interest in your product and your disease area and in medicine generally, because one has to be highly knowledgeable about our product and about the opposition products and the relevant disease area. One has to keep up to date on trends and developments. So a real interest is important. Number three, we need the ability to identify our key opinion leaders, our KOLs, as well as influential healthcare practitioners and decision makers. These people will help us to achieve our goals. And so they are the VIPs, the very important people. They are our targets. Number four, so what does our job involve apart from building those relationships of trust and authenticity? Well, it is working towards identifying the patient's needs, the healthcare professional's patient's needs, and matching them with the benefits of our product, so that the HCP can see the link, can see the help, so that ultimately the HCP automatically thinks of our product when a specific patient comes in. Remember, there are lots of different products out there that are similar. We need to get the HCP to think of us and our product when a certain patient comes in. This is what we work towards. Number five, we need to keep alert for competitor activities and field intelligence. For example, if we notice that the competition is pushing their low side effect profile, we must remember to report this to marketing so that marketing can measure how the opposition's campaign has done with the low side effect profile, and secondly, how we can address that and how our side effect profile matches. Number six, another important aspect of our jobs as a field specialist or a product specialist is to arrange continuous medical education for medical professionals. This involves identifying potential excellent speakers who are also influential in their fields and who support our product. Now, because this is our territory and these are our doctors, we as product specialists are in the best position to identify these HCPs. Reminder number 7 is to take ownership of our territory as if it were our own business. So select little goals to help achieve our main targets. Make our own little business plan, territory analysis, and a plan, noting areas that have growth potential. areas that need more attention, an influential speaker, an area that needs a meeting. Analyze the data ourselves as if it were our territory, our business. And hopefully, we have managers who empower us to do this. And reminder number 8 is to be open to innovative ideas and to speak to our colleagues if we have a problem. For example, if I battle to see a certain key opinion leader, I need to speak to a colleague. They may have the same problem, or they may have found a way to overcome this problem, and they may be able to help you. For example, maybe a joint call, just one, so we can get the ball rolling. But being open to innovative ideas is more than this. Sometimes it looks like marketing and medical have come up with new ideas for no rhyme or reason, and we can't see the benefits. Nevertheless, the idea is to give them a try. Be positive, give them a try, and then report back. And managers, hopefully our managers accept honest feedback and constructive criticism. So that comes to the end of my 8 reminders for the product specialist, field sales specialist. Remember, this is without doubt the most important function of the entire pharmaceutical industry, because without honest, frank relationships, there are no sales. And without sales, our company dies. Remember, we have to be likable, charming, clear, and good listeners. These days, there's information overload. An HCP can get whatever information he wants from the internet in moments. What we have to do is build the relationship, be clear, to the point. And finally, just a reminder that the product specialist is probably one of the most important functions in the whole pharmaceutical industry. And it can be argued that medical and marketing and management should all be working to empower field product specialists. Some may disagree. So thanks for listening. I hope this has been helpful.